Pathology is a wonderful subject. As a MBBS student, you may not know the full power of pathology, but please believe me, it's a very beautiful, very wonderful, and a very helpful subject because in all the other branches, you deal with the patients, whereas here we deal with the doctors. And we can say proudly we are doctors to doctors by doing pathology. And how will you define pathology? Rajeshwari madam was telling most of you are from Rajasthan and you may not know Tamil, but there is a sage called Thiruvalluvar, and we call him as our great grandfather, and he defined pathology. நோய் நாடி நோய் முதல் நாடி அது தணிக்கும் வாய் நாடி வாய்ப்பச் செயல். It's Kural 948. The literal meaning is, whenever you come across a patient with a disease, find out what is the disease, what is causing the disease, and how to treat the disease. Analyze these things. And you all know pathology is asking why, what, when, where. It's all questions. So you identify the disease, what is the disease, what is the cause for the disease, and how to cure the disease, and analyze these three data and treat the patient so that the disease will be eradicated from the patient. And 70% of the medical decisions now are based on our pathology findings, and that tells you how vital the pathology is. And the International Pathology Day is being celebrated for the last 10 years, and every second Wednesday of November is celebrated as International Pathology Day. And as it is 8th November 2023, second Wednesday of this November, we are here to talk about pathology, and I wish you all to have a happy International Pathology Day. As I told you, pathology is a great subject, and it is a path. It is not a simple path, it's an indomitable path. And what is the meaning of indomitable? It's bulletproof, invisible, unbeatable. Nobody can beat this. And it's an indomitable path to today's clinical medicine. And I thank Rajeshwari madam and her team for giving me this privilege to share my thoughts with you all. And if you have, as I told you before, if you have any questions, please raise your hand and contact Rajeshwari madam, and we will discuss about your question and then we will proceed. A lot of events happening in pathology. I want to concentrate three things which are revolutionized recently. In 2010, what we call next generation sequencing become widely available. And 2017, the first digital scanner is cleared for primary diagnosis. We will see what is digital scanning in a minute. And from 2018, artificial intelligence solutions are released, and artificial intelligence play a very vital role. So we will be talking about next generation sequencing, which is now known as massive parallel sequencing, MPS. Because in 2010, it is called as next generation. We should not be calling next generation for the next generation. So we started calling it as massive parallel sequencing. In 2017, what I call digital scanning is a whole slide image. We will talk about it, and AI. So we will be concentrating in the next 20 minutes on massive parallel sequencing, whole slide image, and artificial intelligence. Coming to massive parallel sequencing, before going into that, we should have some basic understanding. I'm pretty sure you all know this, but I just want to repeat. Each cell is made up of the cell membrane. cytoplasm, and the nucleus. This is the three basic structure of the cell. In the cell nucleus, we have chromosome, and this chromosome is made up of DNA, which are having bases, their nucleotides there, and this DNA pass the information to ribosome through mRNA, and after getting the instructions from mRNA, they start producing the amino acids, and they couple these amino acids to form the protein, and these proteins are secreted outside the cell and they become metabolized, and they are known as metabolites. So cell membrane, cytoplasm, nucleus, chromosome, DNA, RNA, amino acids, proteins, and metabolites. This knowledge is very, very important to understand pathology. When you see the architecture along with cell morphology, we call it histopathology. When you analyze only cell morphology, we call it as cytology. When you examine the chromosomes of a particular cell, we call it genetics. When you analyze the DNA, we call genomics. When we read the RNAs, we call transcriptomics. When we examine the proteins, we call that branch of science as proteomics. And when we study the metabolites and what metabolites are causing, it is known as metabolomics. These terminologies are very important because you all know histology, cytology, genetics is we are doing it for ages, whereas genomics, transcriptomics, proteomics, and metabolomics are totally new, and these are very important for the 21st century molecular medicine, and they help us therapeutically, prognostically, diagnostically, and in personalized medicine, which is becoming more and more utilized in the current era. And I kindly ask you to take a snap of this, because basic understanding of this is very, very important. I hope you all have taken a selfie with this slide. We will move to the massive parallel sequencing. We have to know the Human Genome Project, which started in 1990, and 80 to 90% are over by 2003. They want to know what are all the chromosomes in our body. We know there are 46 chromosomes, and they wanted to know each chromosome is made up of what and what they are coding. This coding from the DNA, from the chromosome, is very, very important. If I am able to talk to you, it is because of some proteins and metabolites. If you are all able to hear from me, it is because of proteins and metabolites. So metabolites, proteins are the end product, but as we saw it in the previous slide, they come from the chromosome, DNA, RNA, and then proteins. So we want to know the whole composition of the chromosomes, and now we know we have 46 chromosomes, and in that 46 chromosomes we have 3.2 billion base pairs, and these base pairs form 20,500 genes, and all these genes are very important for our normal function. So this is the cytogenetics. You can see there are 46 chromosomes. For example, I'm going to talk about chromosome 1, the length, number of genes, type, is it autosome or sex chromosome, and what is the centromere position. And this is the picture of chromosome 1, and these are all the genes in the chromosome 1. And abnormality in these genes causes the diseases. For example, the P arm of the chromosome 1 may be abnormal in these conditions, and Q arm is responsible for Alzheimer's disease, hemochromatosis, glaucoma, like that. So the basic understanding from this slide we know what is the composition of all the 46 chromosomes, and whenever there is a disease, it is because of the changes in this genetic material in these 46 chromosomes. So, as I told you, let us compare the human genome with reading a textbook or a storybook. In English, we have 26 alphabets, whereas in genetics, we have call it nucleotides, and we have 4 nucleotides. And these alphabets form words, and these nucleotides form codons. 3 nucleotides combine to form a codon, and fourth nucleotide is the stopping codon that stops the function of the codon. So words are equal to codon, and words leads to sentences, and these codons leads to amino acids, and sentences makes into paragraphs, and proteins are the paragraphs. So please remember, the proteins, they come from nucleotide in the DNA, and 3 nucleotides form the codons, and the fourth one form the stop codon, and these codons signal for the amino acids, and these amino acids forms the proteins, and these proteins gets metabolized, and whatever we do, whatever disease patient is having, they are mainly due to proteins and metabolites. And the next generation or massive parallel sequencing read our DNA letter by letter. That is the massive parallel sequencing. This concept is very, very important. Let us see a case. A 55-year-old male had a progressive neurological symptoms, and a clinical examination revealed focal neurological deficiencies. And this is the MRI. You can all see a large heterogeneously enhancing lesion in the frontal lobe. And to compare with the normal, these are all the normal structure of the brain, and the lesion is here. So the patient underwent a brain biopsy, and the brain biopsy shows material which is stained with H&E. It shows extensive necrosis. Necrosis is bad. You all know in MBBS types of necrosis and apoptosis. Necrosis is a confluent process, whereas apoptosis is a single process. And necrosis is mainly divided into, you all know that, caseous, liquefactive, ischemic necrosis. And another type of necrosis we have to know is tumor necrosis, and other necrosis you may know is fat necrosis and gangrenous necrosis. This is tumor necrosis. And when you go to the high power in the cellular area, the necrosis is garlanded by tumor cells that are highly atypical. See how big this cell is. And this is quite cellular, and this is known as these tumor cells are looking like garland around the necrosis, so we call it garlanding necrosis. And this is very, very diagnostic of high-grade neural tumor, what we call glioblastoma multiforme, and we grade them as a WHO grade 4. So this patient had glioblastoma multiforme grade 4. And is it a final diagnosis? When you ask me, is it a good final diagnosis, I may say yes in 1990. Whereas in 2023, this is not a very good diagnosis, because we have to incorporate certain more things by doing immunohistochemistry, massive parallel sequencing, because these findings are very, very important to decide the treatment and to predict the prognosis. And these are all the various options of treatment available now for the patient. Previously, if there is any tumor, you might have all read about TNM staging in neoplasia chapter. T is for tumor size, N is for nodal status, and M is for metastasis. That also tells tumor size is a local factor. Lymph node metastasis is a regional factor. and metastasis to other organs is a systemic factor. So any cancer, we have to see whether it is local, regional, or systemic. And the basic concept of treatment is, when a cancer is local, we treat it with surgery. When it is regional, we treat with surgery and radiotherapy. When it is systemic, we give medications called chemotherapy. So these are all the three options available. But the last option, chemotherapy, has multiple phases now. So it can be a immunotherapy, it can be a precision oncology. Remember, I told you what genes are affected in what disease. Now we know what cancer affects the what genes, or what gene abnormality causes the cancer, and we can precisely address that finding to treat the treatment, and that is the modern precision or targeted or tailored treatment. In this patient, the immunohistochemistry is positive for GFAP and IDH1 is negative. Then we call it IDH wild type, and GBM IDH wild type has a aggressive course. So that news is very, very important to tailor the treatment. The massive parallel sequencing showed amplification of EGFR, loss of PTEN, and mutation in TP53. You may think these are too much for you. I totally agree. But what I want to visualize is, there are some findings in massive parallel sequencing, and how these findings are going to help in the treatment. So this patient is started with chemotherapy with one of the drug, and since it is a EGFR is amplified, that means EGFR is increased in number. By inhibiting this EGFR, we can get the necrosis of the tumor cells. So EGFR inhibitor is used as a targeted therapy in this patient. And as I told you, the IDH negative is a aggressive variant. And so we have to start looking, in addition to these treatments, we have to start looking for potential clinical trials or alternative treatments happening in those areas. So now you can understand how the massive parallel sequencing is influencing on the treatment, and we pathologists play a very important role in identifying the targets for the oncologists to treat them specifically, targeted treatment. That's about MPS. Coming to whole slide image, it is also known as digital pathology, and I have a small video to play. See, whenever there is a lesion, you can see a lesion, skin lesion there. We have to biopsy it, and when you do biopsy, put it in formalin, send it to pathology. We cut sections and then we put it on the slide. And conventionally, we see under the microscope. You all might have seen the microscope in the practical classes. And if you know the diagnosis, you diagnose that. If you don't know, you have to send it for second opinion or send it to your friend. And physically sending the slide takes a lot of time. So digital pathology, instead of sending, you give the slides to your machine, and that digitalizes the whole slides. And these digitalized slides can be sent through internet to your friends, and you all can get the opinion from them, and they can have their own notes taken on the slides. And these reduces the time taken to send the slide out, to get the opinion, and to start the treatment. So the time can be very much utilized by digitalizing the slides, and that is known as whole slide image. Imagine each section of the microscopic sections are photographed, and these photographs are stitched together like a movie, and then you can see it under the computer. And one of the beautiful future of pathology, we now see only two-dimensional view of a three-dimensional thing, and 3D pathology is coming. I want you to enjoy this small clipping, and this is a biopsy from the prostate cancer. and these are the benign glands, and these are the malignant glands. And let us see how it looks three-dimensionally. See how nice it is. It is like a time travel. You are traveling all along the slide and you can see the three-dimensional structures. And this is also possible because of digitalization of the slides. And the future of pathology will be like this. And this is this looks like a very, very sophisticated massage chair. And this is a project called Pathojet, where it is like pathologists are like pilots. They sit in the chair and they see a broad curved monitor where you can see the whole digitalized slides. So we call it as medical cockpit. And this is a brainchild of Alessandro and Miriam from University of Bern. And I want to show you a small clipping of how it works. So we are like pilots driving the plane, and we drive the slide. And you might have seen the remote control in the hand of the pathologist. And there is a mic and overhead speaker there. So they can start dictating whatever they are seeing, and it will be transcribed and the results will be released. So this will be the future. In another 5 years' time, your pathology department will be having the sophisticated chair where it's like playing a video game. Reporting can be done, and that is very, very positive news, because now you are going into the microscope, and all the pathologists are getting problems with cervical spondylosis and other postural diseases because of constant sitting and bending over the microscope. All of this will be alleviated with Pathojet. And this digitalization of the slide is also very, very important in teaching. I think you all have a slide for your pathology examination, what we call osteoclastoma. So I just want to show you another small clipping where the digitalization helps you in teaching. Here you can see digitalized slide in your screen. You can move the slides. You can go to high power within seconds. And here you can see hypercellular lesion, and you can see two types of cells, large cells and small cells. And when you focus on the high power, the large cells are having multiple nuclei. These are all giant cells. And in the bone, we call them osteoclasts. And you can see a lot of spindle cells in between these giant cells, and the nuclei of these giant cells and the nuclei of the spindle cells are the same. And this is the most characteristic feature of a tumor called osteoclastoma. Oma means swelling. You all might have read it in your place a chapter. And this is osteoclast. That's what we call in the normal bone. And they are enlarged in number, and they form the tumor with two components, osteoclast and the stromal cells. And that's why it is known as osteoclastoma, swelling made up of osteoclasts. I hope you all enjoyed the digital picture. So the benefits of this digital pathology is efficiency and productivity, remote consultation and telepathology, archival and retrieval, education and training. Imagine all your pathology slides are digitalized, and it is available online, and you can see these slides whenever you have time. Unfortunately, when I was doing pathology, we always applied round cover slip is glioblastoma, square cover slip is osteoclastoma, broken cover slip is osteosarcoma, like that. And it's a poor state of my learning at that time. But I kindly request all of you now to look into the cells and to know what is the criteria for diagnosis on that slide. For the example which we have seen, osteoclastoma, there are two types of cells, osteoclast and spindle cells, and the nuclei of the giant cells called osteoclast share the properties with the nuclei of the spindle cells in the background. Like for every tumor, there are specific findings. I kindly request you to see them. And these digitalized slides are available in the world for free. So if you have a question, for example, osteosarcoma, how to diagnose, go to Google Images, put osteosarcoma whole slide image, and you may get a link so that you can learn from that. And these image analysis are very, very important for AI, artificial intelligence, which we will be talking next. There's a broad application of AI, that is the future of pathology. And this slide just tells you there are many, many helpful things in artificial intelligence, but I am trying to concentrate mainly on image analysis, pattern recognition, and building a whole slide report with artificial intelligence. What we do, the computer is a machine. So we train the machine by giving multiple slides, the whole slide images, which we talked in the last few minutes. We give it to the machine and we train them. This is normal, this is tumor, why we call tumor, because of the cytoplasmic changes, nuclear changes. We tell all the criteria to differentiate normal from the tumor to the machine. And then we test the machine, and because of our very good training, the machine will be able to tell correct diagnosis. For example, this is a HNE section of the tumor. This is normal structure and this is the tumor. The machine gives a heat map, red color to the tumor and dark background blue or black color to the non-tumor. That's how it learns, and that will correctly diagnose the tumor. So this is the training portion of the artificial intelligence. And how we apply, this is a lymph node removed from a female patient for breast cancer. And there is a type of cancer known as lobular carcinoma of the breast. And remember, I talked about TNM, tumor size, local, lymph node regional, and metastasis as systemic disease. Here we want to know whether the tumor has come from the breast to the lymph node, from the local region to the regional lymph node. And this HNE section of the lymph node looks normal. But you will be surprised how many tumor cells are there picked up by the computer, by the machine, by artificial intelligence. And if you focus this slide, you can see the tumor cells there, which are difficult to understand or difficult to see initially in the HNE sections. And this machine learning and artificial intelligence identified this spread. So when the tumor spread to lymph node, as I told you, we have to think of radiation or targeted therapy. So this is very, very important. And machine helps us to diagnose the metastasis to the axillary lymph node in case of this breast cancer. Let us take a case scenario. It's a 48-year-old female with a palpable breast lump, and mammogram showed some abnormality. And we put radiology also, we use a lot of artificial intelligence. We teach the criteria for malignancy and we ask the machine to correctly diagnose. After seeing this mammogram, the artificial intelligence called it as suspicious for malignancy. They took core biopsy, and these are all the biopsies from the tumor. And you see how many tumor cells are there, red. All these artificial intelligence picked up these tumor cells. So it diagnosed malignancy. And then, as we told, we have to do immunohistochemistry. and this is for estrogen receptor, progesterone receptor, and HER2/neu. Again, these are all read by artificial intelligence. So from the radiology, pathology, and immunohistochemistry, it gave a diagnosis of infiltrating mammary carcinoma, triple positive, because of the positivity of estrogen receptor, progesterone receptor, and HER2/neu. Then we subjected to molecular events, and these molecular events are also subjected to analysis by artificial intelligence. And because there are some findings in the molecular pathology, the machine predicted high risk of recurrence. So the beauty of artificial intelligence, it is giving a diagnosis with high risk of recurrence prognostic factor in minutes, and all these findings has to be approved by the pathologist and by the oncologist, so that they can start the treatment. The machine itself advised targeted the treatment with anti-HER2/neu and anti-hormonal, because they are all positive here, and that has to be approved by the oncologist, and then the patient is treated. So for a human being to diagnose all these things and to collaborate all the findings, it may take hours, whereas machines can do it in a minute. So that's the beauty of artificial intelligence. So from the clinical findings and radiology and pathology, you all know ChatGPT. If you don't know ChatGPT, please go and Google ChatGPT. It is artificial intelligence, and that will create the whole pathology report. And there is a big question: artificial intelligence, will it replace human beings? Humans created artificial intelligence to help and not to replace the human beings. To answer the questions, artificial intelligence cannot replace human beings. But there is one important concept you have to know: artificial intelligence and a human will replace a human without artificial intelligence. So the person having the artificial intelligence will remove or replace the person without artificial intelligence. So it's a high time to learn artificial intelligence. So in the last 15 to 20 minutes, we covered massive parallel sequencing, whole slide image, and artificial intelligence. And I called it as future of pathology. Is it correct? I don't think so. It is not future of pathology. It is pathology in the present stage. And so we have to change the emojis also. And this pathology is the indomitable path to clinical medicine. These are all my references. I kindly request all of you to take a snap of this, so that you can go. And this video, now again, see, training and learning is totally different. We mainly depend on textbooks during our time, but now everything is available in YouTube, and you can go to ChatGPT and tell, I don't understand apoptosis, can you explain? And can you give me some links, YouTube videos to learn? ChatGPT will give you the things. Okay, so these are all videos, and that helped me to understand whatever I shared with you today. And with this, I wish you all a happy Diwali 2023. I think it's within a week. I think November 12th is Diwali. And I have one kind request: whatever dress you take, please do 5% from a weaver, from cotton, weaved cotton, so that we will support them. With this sharing my view, I wish you all a very happy International Pathology Day, and thank you very much, and have a great time. And over to you, Rajeshwari ma'am. If they have any questions, comments, concerns, problems, complaints, please, we can go through that. Thank you very much for your active listening.